I'm Stella Whitney-West. I'm the CEO for Northpoint Health and Wellness Center, and
just across the street.
Across the street, exactly, formerly known as Pilot City, and we've been around for over 40 years in North Minneapolis. We are a federally qualified health center, and there's two others that are here, one of my colleagues that are here. I think that, and hopefully when you get back to Washington, that you'll take a look at the Senate 525 for the National Association of Community Health Centers. We certainly appreciate it. We would sign off on that and support that. We certainly believe that community health centers are, as I like to call, the public option in healthcare reform, and that we have been providing healthcare homes to the uninsured and the underinsured for over 40 years. We have a high quality of services that we provide. However, we have not been getting the fair share of funding and resources. Particularly here in the state of Minnesota, there's some concerns that we've had with the Department of Human Services, and we are addressing that in the courts as well as with direct communication with them. Our clinic, over 80% of the patients that come there are from communities of color. What is unique about federally qualified health centers is that over 51% of our board members are actual patients of the clinic, and that is required under federal law. And I think that's what gives us a unique position in this debate around healthcare reform, and that our governance is the very patients that we serve. I think your comments, especially around the social determinants of health, are extremely important. As a health center, we provide not only the comprehensive health care, as we have medical, mental health, as well as pharmacy, dental, optometry, but we also have a food.
Dental and optometry, very, very, very important.
Extremely important. But we also have a food shelf. We also provide financial assistance, housing assistance. I think when you talk about beyond healthcare disparity, you have to look at particularly the economic disparities, and making sure that communities that have the health disparities, when you line them up, you also see that those are the same communities that have the economic and educational disparities. Particularly in communities of color here in Minnesota, the high school graduation rate is shameful, and if we don't address that, it is going to be very difficult to have citizens that are able to participate and